Hi, Dr. Becca here with Del Mar Center for Behavioral Health, and I wanted to give a short video for parents who might be getting ready to start ABA or Applied Behavior Analysis services, or even people who are thinking about maybe they'd be interested in starting ABA or Applied Behavior Analysis services. Sometimes parents and other family members aren't exactly sure what to expect. And when we don't know what to expect, that usually creates a lot of anxiety. And it's interesting that we as humans very rarely think, gosh, what if this is amazing? A lot of times we'll think about all of the things that could possibly go wrong. So instead of thinking this ABA thing could be the best thing ever, we may also have thoughts of, what am I going to do with someone in my home for 25, 30 hours a week? Or how am I going to do this? Or what are they going to expect me to do? And that creates a lot of anxiety and sometimes can keep us from taking steps towards goals or even getting therapy because we aren't sure what to expect. And that's totally normal. And so this video is hopefully going to give you some insight about what you can expect in ABA therapy. Typically, research suggests that intensive intervention and as early as possible leads to the greatest and longest lasting gains. So basically, when you have a little guy, we really want to work hard on giving a lot of intervention so that we are taking steps to closing the gap between your kiddo and his or her same-aged peers. And oftentimes that's 20 or 30 hours of intervention per week or more. And so it's normal to have some anxiety about what is that going to look like. And so typically it looks like a mixture of home and clinic-based sessions, right? We have more instructional control in the clinic and more specialized items and activities that can be helpful in that intensive intervention. But it also isn't any good if the child only learns these skills in the clinic. And because our whole goal is to really work ourselves out of a job so that your family can exist without this extra person or this extra team of people present, we also want to have some in-home sessions and some sessions where you're involved so that you're learning the same skills that we are, so that you can be successful with your child without us, and so that we can take those steps towards generalization. And generalization really means that when you learn a skill in one setting, you're able to use it in other settings. So it's great if somebody's toilet trained at the clinic, but that doesn't help when you're at Target or when you're at your house. And so we want to practice these skills all over the place, so that we're working on that generalization, so that skills learned in one setting are able to be used efficiently and effectively in other settings. But generalization is also about the individual. And so while your child might be learning skills with us, right, so your BCBA or your RBT, there's more about those acronyms in another video, so go ahead and check that out if you're not sure what those mean. We want to be sure that he or she is also learning to do those skills, not just in other settings, but with other people. So with me, with the RBT, with you, with grandma, with babysitters, with siblings. And so having you involved is super helpful. Again, working on generalizing to other people, not just other places. The other piece that sometimes parents ask is, or maybe they want to ask and aren't sure how, is, are you supposed to be involved all the time? And the answer is you can be involved as much as you want. I really encourage that wherever your child is and whatever they're participating in, that you are as involved as you want to be. It also is totally normal to not sit in on the entire session, even if we're in your house. You're welcome to be in the room, but you also are welcome to do dishes or run the vacuum sweeper or get some one-on-one time with a sibling. You do not have to be in the room with us at all times. You are certainly welcome to, but you do not have to. And for clinic-based sessions, you are certainly welcome to stay, and you do not have to stay. And so we also want to recognize that when a child is getting that early intervention of those 20 or 30 hours, that's not you taking on another part-time job. I also want to temper that by saying that you will need to be involved to some extent. Because again, if our goal is to work ourselves out of a job, that means that we need to transition those skills to you. And we want you to have the same success that we're having with your child. So we want to teach you how to do the same things that we're doing when they work. We're also not going to expect you to read our minds when that time is supposed to be occurring. We will let you know when we absolutely need you to be there, and we will be scheduling regular family meetings so that we can all, or treatment team meetings, so that we can all be getting together and be sure that we are all on the same page. So those are some of the common questions that people have when it comes to behavior analysis and starting ABA services. If you have any other questions, you can always reach out. You can either comment here, you can send me an email, Dr. Becca at Del Mar Center for Behavioral Health, and I look forward to creating more videos to helping decrease the barriers to accessing this amazing service of ABA that's rooted in science and really has great efficacy and effectiveness for families. Thanks, guys.